My contents are the role of the Health and Disability Commissioner 1994, Code of Rights, legislation requirements around holding health information. The introduction: the Health and Disability Commissioner is an independent agency in New Zealand dedicated to protecting and promoting the rights of health and disability services consumers. The key role of Health and Disability Commissioner: advocacy for consumer rights, promoting and protecting consumers' rights, handling complaints, receiving, investigating, and resolving consumer complaints, handling oversight and monitoring provider performance and compliance, education and training, educating consumers and providers on rights and responsibilities, policy development and advice, advising government and stakeholders on policies and practices, promoting quality improvement, encouraging continuous quality improvements in services, collaboration and coordination, building partnership for better consumer protection and service outcomes. Some impacts of human health. Some impacts of health and disability commissioners are: improves the quality and safety of health and disability services, enhance consumer confidence and trust in the healthcare system, promotes a culture of accountability and continuous improvement among service providers. The Code of Right of Health and Disability Consumers are in New Zealand. The Health and Disability Commissioner is governed by the Code of Health and Disability Services Consumers' Rights. This code outlines the right of consumers when receiving health and disability services. Here is an overview of Code of Rights. Right to be treated with respect, right to freedom from discrimination, coercion and harassment, right to dignity and independence, right to services of an appropriate standard, right to effective communication, right to be fully informed, right to make an informed choice and give informed consent, right to support, right in respect of teaching or research, right to complain. Later I will discuss right in respect of teaching or research, which is my individual. Okay. The legislation around holding health information. In New Zealand, the legislation governing the handling of health information is primarily outlined in the Health Information Privacy Code 2020, which is code of practice issues under the Privacy Act 2020. This code sets specific rules for agencies in the health sector regarding how they should collect, use, store, and disclose health information. New Zealand Public Health and Disability Act 2000. The New Zealand Public Health and Disability Act 2000 represents a comprehensive framework for managing and delivering health and disability services with a strong focus on equity, quality, and public involvement. Health Act 1956. The Health Act 1956 is a fundamental piece of legislation in New Zealand that provides the legal framework for public health and safety. It outlines the responsibilities of government and local authorities in managing public health issues, including the prevention and control of infectious disease, sanitation, environmental health, and the regulations of health services. The Act empowers public health officials to enforce health standards, respond to public health emergencies, and implement measures to protect community health. It also includes provisions for the establishment and the duties of health boards and officials, ensuring a coordinated approach to maintaining and promoting public health across the country. Privacy Act 2020 in New Zealand governs the handling of personal information to protect individual privacy. It updates and strengthens privacy principles, mandates brief notification to affected individuals and privacy commissioner, and enhanced enforcement powers, including compliance notice and fine. The Act applies extraterritorially, requires data minimizations and protection, and grants individual right to access and collect their data. It regulates cross-border data transfer to ensure continued protections and encourage organizations to conduct privacy impact assessment to mitigate risks. Health Information Privacy Code 2020. The Health Information Privacy Code 2020 in New Zealand sets rules for handling health information, ensuring it's collected, used, stored, and disclosed to protect individual privacy. It includes guidelines on consent, accuracy, security, patients' access to record, and brief reporting, tailored specifically for health information. Public Record Act 2005, the Public Record Act 2005 in New Zealand mandates the creation, management, and preservation of public record by government agency to ensure accountability, transparency, and preservation of the country documentary heritage. The code of right, my one is right in respect of teaching or research. Consumers have a right to refuse to participate in teaching or research activities. It means consumers have a right to refuse if they don't like to participate, because no one can push them or force them for participation. Participation in teaching or research must be entirely voluntary. It means should not be charged for teaching or researching during researching. Full disclosure of relevant information must be provided to the consumer before they agree to participate. It means consumers should be fully informed what we are going to pursuing during the teaching time. Consumers should be informed of any potential risks, benefit, and the purpose of the research or teaching. The right to withdraw from teaching or research at any time without affecting the standard of care they receive. It means if the consumer they want to participate in initially, but later if they don't like to participate, we have to let them go without affecting the standard of care. For examples, the summary of this example is students or consumers should be treated with respectfully and we have to respectfully and their confidentiality should be maintained, which helps to promote the ethical conduct and protecting the dignity and autonomy of individual involved.